Tonight, we come together to celebrate BCH, to celebrate the collective community that has made this work possible over the past 100 years. Like others of its generation, BCH's life has been quite a journey. What started as a small converted house in a small Colorado town has evolved into a regional health system that spans across Boulder Valley and also attracts patients from around the country. Tonight's program is a chance to reflect on our incredible past, recognize our present, and look ahead to an even brighter future. It's not every day that you get to celebrate your 100th anniversary, so you can imagine we have a few things planned from today through the end of the year to make sure that we are recognizing this at every turn. And we have such an incredible level of support from across our community that is making this possible. Today is Boulder Community Health Day. We did not receive the key to the city or to the state, but we did have a lot of different people come out to join us in the celebration. So from Governor Polis to Representative Neguse to Erie, Superior, Lafayette, and the city of Boulder, everybody is recognizing what it means to be an independent community health system that is locally governed, and the fact that 100 years later, we're still standing. And we're not only standing, but we are thriving. And everybody's here to recognize that work that we do. And we actually have a little bit of a special guest. So Mayor Pro Tem Rachel Friend, who is part of the City of Boulder City Council, has a special message for everybody.
Boulder Community Health now encompasses 2,000 employees, 700 physicians and other clinicians on its medical staff, and 200 volunteers. Boulder Community Health remains one of only two independent health systems in the state of Colorado. And we, the City Council of the City of Boulder, Colorado, declare April 19th, 2022 as Boulder Community Health Day in recognition of the vital services that the doctors, nurses, staff, and volunteers at Boulder Community Health have provided and continue to provide for the families of our community. I'm very excited to be reading this declaration at BCH's Centennial Town Hall celebration this evening, happening both in person and streaming virtually. Huge congratulations on 100 years, and thank you so much for keeping our community healthy for the next 100 years to come. Thank you all.
There's a couple of signature events that have been designed. So one is the 30-day movement challenge. And this is something that we're starting in mid-May. Gina, is that right? May what? Thank you, May 15th. And we are partnering with Parks and Rec across the county, and that this card will be distributed both digitally and in person through all the Parks and Rec and a number of other partners, including the Chamber, to encourage people to move. And that means something very different for everybody, but this is an opportunity to encourage them to get out there and then enter every day to win a different prize from BCH. In addition, Museum of Boulder over at Broadway and Pine, they are doing a special exhibit in mid-August through mid-September that will also be commemorating BCH in our history.
I want to personally welcome all of you to tonight's celebration. Those of us here tonight are part of Boulder Community Health's ongoing legacy of healthcare excellence. Generations of BCH staff and physicians have provided high-quality care for our friends, our neighbors, and their families for 100 years. I am certainly humbled, and I know we should all be incredibly proud to be part of this great tradition. I do want to start with recognizing current and former members of our board of directors and board of trustees who are here in person and virtually. It is hard for me to express to you how much time and energy and passion they dedicate to BCH. They help myself and our leadership team develop our plans, and more importantly, channel the community needs and help us move towards our vision. Our board members are chosen to represent the diversity within our community and to help us recognize the community needs and how they're evolving. Our board is directly responsible for BCH maintaining our independence and our focus in meeting the local needs. And this has been true for generations of board members and is as true today as it has been 100 years ago. I think it's important, and you hear this often, but to remind you that we are one of two remaining independent nonprofit health systems in Colorado. And what this really means is that we have local governance that cares for and looks out for the healthcare needs of our local community. Behavioral health services are a great example of being responsive to the needs of our community. I think we're all more than aware of the tremendous challenge that we face and the lack of services, unfortunately, that we experience across Colorado. Yet, because of the passion and the vision and the commitment of our board, we recently committed $45 million to the opening of the De La Cava Pavilion to further meet and to begin what is an ongoing journey to meet the behavioral health needs of our community. It's a similar story with many investments that we make across our healthcare continuum and within our hospitals and out in our community and our clinics. And our board and the leadership is thoughtful but sets very aggressive goals to be world-class, to provide the highest quality care to our community. It's their expectation, it should be, and we're here to fulfill that. But remaining a leader in healthcare is an ongoing challenge because technology is constantly evolving. I'll tell you that as a CEO, I frequently meet with physicians who've recently or are considering coming to our community. And to a person, just as I was 8 years ago, are astonished at the breadth and the depth and the skill and the quality of the care that we're able to provide in this small system. Some things that you can't find even in much larger tertiary care systems. But at the root of that is the high quality and excellence of our providers and our frontline staff. And because of that, we continue to be able to attract high quality people. It seems the more we give to our patients and their families, the more we get back from our community. This ongoing pandemic has been incredibly stressful and exhausting for everybody, and in particular for our frontline staff. But we've also experienced unprecedented support for us and our mission. We've experienced tremendous outpouring of financial support through the work of the foundation. I remember people driving up to foothills with carloads full of PPE to help protect our staff and the care they provide. I can remember going to the cafeteria enjoying sushi along with the rest of our frontline workers that was provided by our local restaurants. The whistles, the howls, the applause from our neighbors echoing through the night skies at the height of the pandemic. Almost every single day, someone did something caring and wonderful for us. To me, it shows that it takes a great community to sustain and create great health care. So thank you all.
During the very earliest days of the state, some very smart business leaders and residents set a trajectory for the character of this community by deciding to fight for the state university, not the state prison. Very smart. I think they made the right choice, as the university would later spawn many innovative businesses that drive Boulder's economy. It was that same university that gave birth in 1889 to Boulder's very first hospital, co-located with the university's medical school. And when the university decided to move the medical school to Denver in 1920, it was those very smart chamber leaders who first negotiated with the university to let them operate the hospital on the university campus for 3 years until we could construct our very own standalone hospital facility that would later become Boulder Community Health, which opened its doors, as has been said, in 1922. Very smart. Yes, very smart indeed, as the economic impact of Boulder Community Health to the city of Boulder's economy goes beyond mere direct dollars, which Boulder Community Health Foundation Executive Director Grant Besser tells me is gazillions. No, there is no vibrant economy without a strong healthcare system, with Boulder Community Health at its core. Think about what it means day to day for businesses and residents to know that they have ready access to top-tier medical services. It is the very essence of a stable community on which a strong economy grows. That stability, as was acknowledged earlier, was tested many times over the past year. But Boulder Community Health met the challenge, heroically serving our community with life-saving treatments and health services. But Boulder Community Health plays a pivotal role in the health of our economy in many other ways. The Boulder brand is health and physical fitness, which makes us a magnet for many outdoor recreation businesses and those who want to conduct business in a healthy environment. But who is it that provides the care for those top athletes and wannabes? It's BCH. With the latest orthopedic services and surgical technologies to assist injured athletes, along with expert training and rehabilitation services through the CU Sports Medicine and Performance Center. Boulder's also proud to feature an innovation economy, and BCH fits that brand to a T. BCH physicians are committed to providing the latest treatments. Their doctors partner with BCH in bringing cutting-edge technologies to this area. And people from across the country regularly travel to Boulder for specialized treatments. And finally, I reflect on the mission of Boulder Community Health. The BCH vision, as has been stated, is to create and care for the healthiest community in the nation. It is no coincidence that BCH shares a common vision with the Boulder Chamber to build community through business. It is that dedication to community that we share, whether it's through strong economy or whether it's through a strong healthcare system. We all join together in making and building a strong community. And it's looking around this room today that it's my great pleasure on behalf of the Boulder Chamber and the Boulder business community to celebrate with all of you and say, congratulations, Boulder Community Health, on 100 years.
A big part of the history of BCH is the history of the foundation, which is here every day to inspire the community to help enhance healthcare in our community. For over 4 decades, since our inception in 1978, when the foundation first started, we have raised, through the support of the community, over $70 million. That has gone to capital investments, that's gone to many of the programmatic investments that you've been hearing about tonight. Over that time, $60 million has been contributed to BCH of that $70 million, and we've also established a $60 million endowment, and that ensures the long-term support of our system. That ensures the $3 to $5 million that we're doing every year toward various programmatic and capital investments to continue to elevate the care that we provide. I am excited to announce the single largest gift in Boulder Community Health history. A $5 million donation has been made from Suzanne and David Hoover, longtime supporters of BCH, in support of our greatest asset, our people, and the future investment of our world-class surgical center, the Hoover Family Surgical Center. So please join me in thanking them. Their generous donation will go to 2 core priorities. $1 million is going toward future capital improvements of our surgical center, and $4 million is going toward the establishment of the Hoover Family Center for Education Excellence. Pretty cool. This is going to provide across-the-board financial support for the BCH care team members wanting to update their skills and knowledge. If you want to go forward 1 slide. This program will give everybody from our environmental services team to nurses the means to develop new skill sets and to become the leaders of the future of BCH. In the process, we will enhance patient care through staff who are personally committed to updating their skills, providing their best at the top of their licensure every day, and also help us to attract and retain talent in an incredibly competitive environment right now, and will provide us a competitive advantage across the Front Range. Financial supports can be provided for post-secondary education, continuing education units, new certification, and student loan repayment assistance, which we are strategically using for new hires. Dave and Suzanne, unfortunately, are not able to be here tonight, but they were kind enough to do a little thank you video, or actually an announcement video for us. So I will go to that.
Good evening and greetings from sunny Florida. We are so sorry to be missing this wonderful event celebrating BCH's 100th birthday. It is truly remarkable that BCH has been serving our community's needs for that many years. As many of you know, David and I have supported BCH through the foundation for many years with annual gifts and through capital campaigns used to build out the Foothills campus.
We're fortunate to be in a position to make this gift. Suzanne and I have focused our giving on education and healthcare. This gift supports both, so it's a good fit for us. And as a veteran of 4 surgeries at BCH over the years, further support for the surgery center was attractive, particularly to me. The establishment of the Foothills campus and its growth over the years is really impressive. The importance of first-class facilities and equipment is very important and obvious. We're pleased to be able to support the surgery center.
While we recognize the need for excellent facilities and state-of-the-art equipment for a hospital to provide outstanding care for its patients, we also recognize that what really makes a healthcare system tick is the people. The nurses, the doctors, the caregivers, the technician, and staff, support staff at all levels. We are really pleased that the bulk of our gift will be used to establish an endowed fund to support the educational endeavors of the staff. It is our hope that this gift will help staff members reach their personal goals and will help BCH meet its goal of making Boulder the healthiest community in the country.
We want to thank you for allowing us to share in this great celebration of BCH turning 100. We take pride in our combined board service to BCH and the foundation, and we're thankful for the excellent care that we and our family have received from Boulder Community Health. We'll be back in Colorado soon and look forward to seeing many of you again. This is a great event. Enjoy the celebration. Happy birthday, BCH.
At the end of BCH's first century, we all have been through a most challenging time, both personally and professionally. And there have been many different types of challenges across this first 100 years in this first century. But despite these challenges, we have demonstrated our ability to grow, to improve, and to care for this community, and most importantly, for each other. This organization's leaders and staff in this first 100 years have taught us how to be caring, how to be strategic, forward-thinking, nimble, and fiscally responsible. And what all of us have come to know during our time here at BCH is that our community is an equally important part of our care team. Through their financial support, through the advocacy that they do, through board leadership, through all of the partnerships that we have created, our community has been beside BCH, guiding us from that very first infancy to today, our 100th anniversary of serving this community. We were all born to be BCH, and BCH was born out of this community. So as we head into the next 100 years of caring for this community, I am very proud to stand with all of you in our journey to partner together to create and care for the healthiest community in the nation. So I get the privilege and the honor of doing a toast. And so we are going to do a toast, and then I want you all to join me in 3 cheers. So a hip, hip, hooray, 3 of them for BCH's birthday. So all together now, here is for at least another 100 years of serving this community. Hip, hip, hooray! Hip, hip, hooray! Hip, hip, hooray! Happy birthday, BCH.